Hi, guys. I'm reminded of a great line. I think it was from The Godfather, which goes, just when I tried to get out, they pull me back in. And that's how I feel about this COVID stuff. I mean, here it is 2023, and the circus keeps swirling around. Now, it appears that some progress has been made in getting the truth out to people, but I'm afraid it's still pretty weak. So I don't know what country you're in, but if you're in the United States, you're not getting any information from anybody about anything unless you're doing, I would say now, thousands of hours of research. So people ask me why I've spent so much time on this, and sometimes I wonder myself. But I kind of would like my customers and clients and friends and their families not to die and become disabled because of maniacal and criminal public health, medical, and scientific officials. I mean, I'm funny that way. Unfortunately, everything that I have said since February 1st, 2020, and yes, it is February 1st, 2020. It's all in this book. If you don't have it, everything's time stamped. I would have given anything to be wrong. I would have much preferred to be disgraced and called a fool for all the alarms that I sounded. But unfortunately, I wasn't wrong about anything. All right, so to help, what I'm doing right now is I put together a 20-minute reel that brings everybody up to date on where we are. So if you need your strength, if your resolve strengthened, this video will help. If you need to persuade friends, family members, colleagues that maybe this thing wasn't exactly as it was presented to us, I think this video will help. My point of view about making money has always been very clear. The purpose to make money is twofold. One, to earn your own freedom, because if you're working for somebody else or don't have your own multiple streams of income, you are a slave. You might be a glorified slave, but you are a slave. So number one, get your own freedom. And then number two, hopefully get to the point where you are strong enough that you can fight for the freedom of all of us. And that's why we have a United States of America, because a whole lot of successful people in the 1760s and 70s decided to fight back. We don't see that anymore today, I'm afraid. I'm looking still for even one internet marketing colleague to join me in what I'm doing. And a lot of them behind the scenes give me attaboys and pats on the back, but for whatever reason, they're not willing to stand up. So say la vie. But anyway, this 20 minutes will be helpful. I still do marketing advice. In fact, I'm probably the only guy that helped sell 1 million hardcover books in the face of a total news media and advertising blackout. I doubt your local guru has done anything like that. So it all happens behind the walls of the System Club. If you're interested in the real deal about how things really work, you have to wonder if your friendly local guru hasn't been willing to stand up for this. What other kinds of facts are he or she shading? It may be not well known, especially to newish people, but I'm not very popular among the vast majority of gurus. And that is because I have never hesitated, especially way back, to call them out on their BS. There's a whole lot of people that started with me in the System Seminar as faculty members that got thrown off because they just were so bad. And they got bad. They didn't start bad. They were very nice and shiny when they started, but as soon as they started to get some background and acclaim, they started taking advantage of their customers, and that's when they were dismissed from the System Seminar. And some of them didn't like it. Some of them thought I was too harsh, but I am glad for every single one of them that I fired. They all deserved it. And anyway, you got to wonder if people aren't willing to stand up for something this big, what else are they shading? And probably a lot. Anyway, here's 20 minutes, less than 20 minutes actually, that will bring you up to date so that you know exactly where we stand. And this is being recorded on February 1st, 2023.
You don't get to say, ignore what's going on here. There will be the ability, particularly in rich countries, to open up if things are done well over the next few months. But for the world at large, normalcy only returns when we've largely vaccinated the entire global population. We also need to fix the three problems with vaccines. The current vaccines are not infection blocking. They're not broad, so when new variants come up, you lose protection. And they have very short duration.
Mr. Bourla, can I ask you, when did you know that the vaccines didn't stop transmission? How long did you know that without saying it publicly?
Thank you very much.
I'm sorry. Answer that question. I mean, we now know that the vaccines didn't stop transmission, but why did you keep it secret? You said it was 100% effective, then 90%, then 80%, then 70%. But we now know that the vaccines do not stop transmission. Why did you keep that secret?
Have a nice day.
I won't have a nice day until I know the answer. Why did you keep it a secret that your vaccine did not stop transmission?
When I was engaging with doctors in online conversations, I would say, have you read the actual study? And overwhelmingly, I would say, the answer was, no, I haven't read the study. And I thought to myself, well, what are you actually going on here? What the mainstream media is saying, what the big pharma talking points are? Okay, fair enough. Maybe you've got a lot on your plate. A few months later, I remember I would ask again, 6 months later, have you read the study yet? Overwhelmingly again, the answer was, no, I haven't read the study. A year later, same thing. And I would guarantee you all right now, anywhere in the world, if you go out there and do a survey of doctors of all specialties, the majority of doctors haven't even read those studies. Think about this, and this is my thought to these doctors. You are a doctor. This is the most important medical story of your lifetime. The entire world has been turned upside down, and you haven't even read the study. What the hell is going on? What is your excuse for that? There may be lots of reasons why the medical profession is not doing its job. Doctors are not being critical thinkers. Maybe it's intellectual laziness. Maybe they're very busy and haven't got the time. I don't think that's an excuse, by the way. Maybe the medical profession are complete slaves to big pharma and the mainstream media establishment. Of course, we know that that is a big element to this as well. It's the way that doctors are trained. But this cannot be allowed to continue. It's simply unacceptable because it will keep on happening again. That line, 95% effective, is etched in my mind. 95% effective, 95% effective. Doctors going around like robots. I mean, doctors may as well be trained chimpanzees, mindlessly regurgitating that line. I remember back in 2021, I saw a very high-ranking physician, and he was probably one of the most well-qualified in his field, and he was mindlessly repeating that. And ever since the beginning, whenever I've heard that line, I have thought to myself, what does that even mean? 95% effective. Who are you talking about? What groups of people? How long is that 95% efficacy? Have you even thought this through? You are a doctor. You've got a medical degree. How can you mindlessly repeat a big pharma talking point without thinking about it? It is a complete failure of the system that we have allowed this to happen. Maybe it's even deliberate among sections of the establishment to not want to ask these questions. Nothing would surprise me. But doctors, you cannot escape your responsibility for the fact that you didn't ask these questions.
We know who's vulnerable. Older people, people with certain chronic conditions. Move heaven and earth to protect them. Right? So we outlined a whole bunch of ideas for this. We can talk about some of these ideas in a bit if you want. Mm-hmm. The other thing is that the lockdown harms are devastating. 100 million people have been thrown into poverty worldwide as a consequence of the economic harms caused by lockdown. People skipped cancer treatments, people skipped heart attack treatments, people skipped diabetes management care. The psychological harm is on a scale. Like in June of 2020, 1 in 4 young adults reported to the CDC that they had seriously considered suicide in the United States. So the harm, the public health harm of these lockdowns, I just can't overstress how harmful these lockdowns were. to the population at large from a public health point of view. Not forget about the economics, just in terms of health outcomes. There was a study that suggested we close schools down, right?
Yes.
A study done, published in JAMA Pediatrics, found that
JAMA is the Journal of the
American Medical Association.
Thank you.
It's
one of the 3 or 4 most prestigious medical journals in this country, correct?
Yeah.
All right.
For JAMA Pediatrics, that estimated how just closing the schools for a couple of months in May, April and May, what effect would it have on the lives of these children? Because it turns out that closing schools down, you get learning loss that then echoes throughout a kid's entire life. They lead shorter, poorer, less healthy lives. So the estimate was 5.5 million life years lost just from that school. 5.5 million
closed
life
down
years.
in the previous spring.
Yeah.
That had already happened. All right. So Focus Protection says, move heaven and earth to protect the older and do what with everybody else?
End the lockdown. Many people in the public health community was to throw up their hands and say, we can't do it. Now, what they're saying, and what they had in the back of their heads, and you can see from the policy, was that if we lock down, we will protect the old, we will protect the vulnerable, just by the fact that we've stopped the disease from spreading.
Right.
That's turned out to be catastrophically false. 80% of the deaths in the United States are people over 60. 80% of the deaths are people over 60. We did not protect the vulnerable, because we didn't even attempt to protect the vulnerable. Just to give you some sense of how backward it was, we sent people in the early days of the epidemic that were infected with COVID back to nursing homes, who then infected a large number of vulnerable people. Instead of realizing who the vulnerable were and seeking to protect them, that was a scarce resource. We thought hospital beds were the scarce resource. Well, most parts of the country in March, April 2020 went empty.
The costs of the lockdown. You've gone into the costs a little bit. You've mentioned the costs. Here we are taping this program in October 2021. What do we know? I'd like, if I may, to break it down to what we know about the costs that the lockdown has imposed in this country and then elsewhere in the world. What do we know about the costs of the lockdown in this country? What are the figures that have come in?
I mean, I think this is one of those things where it's difficult to say in a short number of words, because the scope of it is so devastating. So like we've already talked about children, the lost schooling for children, the lost opportunities for children. That will last, the effects of that will last their life, their entire life. We'll be counting those costs for a very long time. The psychological harms that I mentioned, there have been a vast increase in opioid deaths. Remember during the 2008 Great Recession?
Yes.
There was a deaths of despair.
Yes.
Well, those are back, but magnified. There are
alcoholism, opioid abuse, domestic violence.
Yeah, let me give you a very small one on children. The reports of child abuse declined during the 2020 during the lockdown. Mm-hmm. It wasn't that children weren't being abused. That child abuse tends to get picked up at school. So what we had was a huge increase, unmeasured, in child abuse that was not dealt with properly by authorities. Domestic abuse is a very similar kind of thing. So let me just talk very quickly about what the state of the scientific evidence is. And I'll give you in a very, very simple way. In Europe, the European CDC says that masking kids under 12 is not recommended. In the United States, the U.S. CDC says that masking kids 2 and up, toddlers and up, is required. The science is not settled on masks. And it's very simple. We don't have good data on it. We do not have randomized evidence.
Why not? It's been 18 months. The CDC is funded to the extent of billions of dollars. Why haven't they tested masks?
It's a really good question. I wish I knew the answer. The professed ideals that many, many people have, concern for the poor, concern for the working class, concern for children, as best I can tell, that concern was lip service.
Published in the journal Vaccine, Serious Adverse Events of Special Interest Following mRNA Vaccinations. Full text available free, get it for yourself. Section 3.4 of this article Harm-benefit considerations in the Moderna trial, the excess risk of serious adverse events of serious interest was 15 per 10,000 doses. That works out at 1 in 662 vaccine doses. And that is over placebo baseline. Now, in the Pfizer trial, things were even worse. The excess risk of adverse events of special interest were 10.1 per 10,000. That works out at 1 in 990. Combined, that gives us 12.5 per 10,000 vaccinated, which is 1 in 800. And that actually works out at 1,250 serious adverse events for each million people vaccinated. So that brings us straight onto this paper here that we want to look at, this one from the UK government. So it's looking at estimated number needed to vaccinate to prevent COVID-19 hospitalisation. So there's nothing about anything else, just hospitalisation. And it gives us information for the primary vaccine, that's the first and second dose, for the booster vaccine, third dose, and for the autumn booster programme, and potentially looking at a spring booster as well for 2023. Published, as we say, 25th of January. Now, calculation of the number needed to vaccinate. This is Table 3. Number needed to vaccinate to prevent hospitalisation for different vaccination schedules. Now, I'm just going to give you a couple of examples here. So, 20 to 29-year-olds, for the autumn booster, you would need to vaccinate 169,200 people aged 20 to 29 to prevent one hospitalisation. You would need to vaccinate 706,500 in the age 20 to 29 to prevent one serious hospitalisation requiring oxygen or ventilation. So you'd have to vaccinate an awful lot to prevent one serious adverse events. That's if they have no risk. Now, in a high-risk group, in the same age, 20 to 29, the risk is you'd have to vaccinate 7,500 to prevent one hospitalisation, and you'd have to vaccinate 59,500 to prevent one serious hospitalisation. And remember, the risks of the adverse events are about 1 in 800. So we can clearly see that the risk of an adverse event is much greater than the risk of hospitalisation in this younger age group. Now, this 1 in 800, unfortunately, is not age stratified, but we know that younger people have a higher risk of adverse events, because for the original trials, we haven't yet been given the participant level data. We've been waiting for that for some time now, still hasn't arrived. 50 to 59-year-olds, autumn booster again. People that are of no risk, otherwise healthy. You'd have to vaccinate 43,600 of those to prevent one hospitalisation. People aged 50 to 59 years, autumn boosters, you'd have to boost 256,400 to prevent one serious hospitalisation requiring oxygen or ventilation. In a risk group, you'd have to vaccinate 3,100 to prevent one hospitalisation. You'd have to vaccinate 18,600 to prevent one serious hospitalisation. So let's say the risk of serious adverse events were only 1 in 2,000. We know it's much lower than that, but you can still see that the risk associated with vaccination is greater than the risk of hospitalisation. That's what the figures are showing. 60 to 69-year-old autumn booster, 3,600. That's 27,300 for serious events. So you're aged 60 to 69 years of age for autumn boosters. To prevent one hospitalisation, you'd have to vaccinate 3,600 of us. You'd have to vaccinate 27,300 of us to prevent one serious hospitalisation. Over 70, you'd have to vaccinate 800 to prevent one hospitalisation, and you'd have to vaccinate 7,500 to prevent one serious hospitalisation. So even in this age group, the benefits of the autumn vaccine are minimal, if anything, over the risk of an adverse event of a special interest based on the original Pfizer and Moderna phase 3 clinical trials.
What about the duration of the vaccine? I mean, I've gotten, I think, 2 or 3 boosters now to the initial vaccine.
Yeah.
It lasts a while. Are we going to have to get it every year, or are you developing something that might actually last longer?
Yeah, it doesn't last the current ones, and also doesn't last the disease. For example, if you get disease, you can get disease again after 3 months. With the same even variant, not even absent a change of the variant. That's why it's very difficult for this virus to eradicate. I don't think it will. But we are working to see if we can get an annual vaccine. An annual vaccine will be ideal because people will remember, they can do it with other vaccinations like flu, and can last.
Okay, flu, you raised it.
Yeah.
Where are you in developing, because I think that's what you were originally doing with BioNTech. You were developing mRNA for flu. Where are you on a flu vaccine based on mRNA?
Oh, the studies are running. They have completely recruited. We are waiting for cases as they accumulate. Means that people have been vaccinated, placebo, vaccine, and then the disease, some of them will get disease, and then we are waiting to unblind the data to see what is coming. I think will come in this year, in 2023.
Well, that's what I was going to ask. I mean, you can't guarantee a timeline depending on the clinical trials.
No, because
but your best guess, what would you think?
I think by the first half of the year, maybe.
First half of the year?
Yeah, June, July.
Well, get ready for annual COVID shots thanks to the FDA and the CDC. On January 26th last week, the FDA Advisory Committee held a meeting. Mainstream media largely ignored the story, and the vote was on annual vaccines. And not surprisingly, they voted to let you skip the original vaccine and go straight to getting those COVID booster shots once a year. So what does it actually mean to skip that initial shot? I think this message is quite muddy. Well, children and older Americans would be able to get more than 1 booster per year. You can double up if you want.
I think it's around things like, how do you make sure you get the right scientific cooperation and the cooperation between the regulatory authorities so in the future you can clear things much faster? I think there's a huge impetus now for a national digital infrastructure. Digitization in healthcare is, I think, one of the great game changers. You know, we should be helping countries to develop a national digital infrastructure, which they will need with these new vaccines. In the end, you need the data. You need to know who's been vaccinated and who hasn't been. Some of the vaccines that will come on down the line will be multiple. There'll be multiple shots. So you've got to have, for reasons to do with the healthcare more generally, but certainly for a pandemic or for vaccines, you've got to have a proper digital infrastructure. And many countries don't have that. In fact, most countries don't have that.
And that's why on pandemic preparedness, we support efforts to develop a new global health legal instrument, strengthened international health regulations, and a strong and empowered World Health Organization.
In 2010, Anthony Fauci of the NIH and Margaret Chan of the WHO were paid by the Bill and Melinda Gates Foundation to be on the board of its, quote, Decade of the Vaccine program.
Eventually, what we'll have to have is certificates of who's a recovered person, who's a vaccinated person, because you don't want people moving around the world where you'll have some countries that won't have it under control. Sadly, you don't want to completely block off the ability for those, people to go there and come back and move around. So eventually there will be sort of this digital immunity proof that will help facilitate the global reopening up.
We're joined by Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, good evening to you.
Good evening.
Despite those numbers we just gave, this past week in this country, the reported number of cases of H1N1 were down. Should we be encouraged by that?
I think it's really premature to get any encouragement for that. There was a little blip down in the pattern of the number of cases, but since flu is eminently unpredictable, I think it's really dangerous to make any assumptions as what's going to happen over the next few weeks or months.
The virus raised the rules, and this one, like all influenza viruses, can change the rules without rhyme or reason at any time.